Dr. Nish Panu is a nephrologist and professor in the Department of Medicine at the University of Alberta. She received her medical training at the University of Alberta, Stanford University, and completed her SM in epidemiology and biostatistics at Harvard University. Her research interests are primarily in the area of diagnosis, management, and outcomes of acute kidney injury. She is a member of the Alberta Kidney Disease Network and the Interdisciplinary Chronic Disease Collaboration. She also holds positions as the co-scientific director of the Kidney Strategic Clinical Network and the Assistant Dean of Clinical Research Platforms at the University of Alberta. We welcome Dr. Panu. You were on mute. Oh, okay.
Yeah, you had to unmute me. Thanks, Flavia.
Apologize, sorry about that.
Okay, I'm just going to put up my slides here. Now, can everybody see my slides?
Oh, now we see you.
Okay. Let me take a look and see. Now, for some reason, sorry, everyone, some technical difficulties here. Flavia, should I send you my slides? I can just email them to you.
Yes, perfect.
Okay, just 1 second.
Sorry for the delay, everyone. We're just working on putting up those slides for Dr. Panu.
Okay, so maybe we can put them into full view. Yeah, perfect. Okay, sorry about the delay there, everybody. Thank you for spending the time to come and to listen to me and this presentation this evening. I am speaking on behalf of the Kidney Health section of the Medicine Strategic Clinical Network. So I'll get you to just advance the slide there, Flavia. Great. So I'm just going to start off. I imagine there are probably many of you in the audience who don't know what the strategic clinical networks are. Some of you may already participate in them, but just to give you a slight overview of what the work of the networks is and some of the things that we've been doing over the last couple of years, I'll start by just kind of giving you an overview. So I'll get you to switch to the next slide, Flavia. Great. So the strategic clinical networks are an entity that were created within Alberta Health Services in 2011. And the idea behind them was really to bring together all participants in the healthcare delivery of any particular section. So patients, providers, decision makers, as well as researchers, to focus and to work together in a collaborative fashion to improve the care that's delivered across the province using evidence-based medicine. So at the initiation of the strategic clinical networks in 2011, there were, I believe, originally 8 networks were identified. That is subsequently expanded to its current number of 11 strategic clinical networks. So when Kidney Health had its own strategic clinical network up until a couple of years ago, we are now represented in the medicine strategic clinical network, which was created in 2020. So that would include kidney health, respiratory health, as well as hospital medicine. Next slide. So really, as I mentioned earlier, the purpose of this SCN is really to bring together the expertise of operational leaders within the healthcare system, clinicians, patient advisors, all healthcare providers of all disciplines, including nurses, allied health providers, pharmacists, community partners, including the Kidney Foundation, to come together to essentially identify and then solve problems within the healthcare system. So, as I mentioned before, Kidney Health was sort of merged into the Medical Strategic Clinical Network approximately a year ago. We still retain an organizational structure on the kidney health side, including our own scientific office that is led by Scott Clarenbach, who is a nephrologist here at the University of Alberta, as well as myself. You can go on to the next slide, Flavia. Next slide, please. Oh, there we go. So one of the sort of key components of each strategic clinical network is the Patient and Family Advisory Council. And this is an opportunity where patients and family members and fellow caregivers can have direct input into issues that they identify as being amenable to improvement or within the healthcare system. So there is an active Patient and Family Advisory Council within the Medicine Strategic Clinical Network, which very much directly informs our priorities, both in terms of improving clinical care as well as our research questions. So I know this is quite a busy slide, but I just want to sort of alert you to the fact that there are really essentially 3 main sort of pillars so within each strategic clinical network, we create transformational roadmaps. And these are really an articulation of a mission, a vision, strategic priorities, as well as research priorities within each network. So the Medicine Strategic Clinical Network really has identified 3 strategic directions. The first is really to empower patients to improve their experience and health outcomes. The second is to enhance integration of both acute and chronic disease management, as well as transitions between hospitals and acute care and the community. And then thirdly, to identify opportunities and address gaps in care and enable clinical best practices that would reduce unwanted variation in the way that we deliver healthcare to our populations. So underneath those 3 strategic directions, the kidney health section, the respiratory or pulmonary section, and the medicine section all have priorities that they've identified. The kidney health priorities very much align with work that we've done in the past with, in our own transformational roadmap, which was developed in about 2019. But you can kind of see them on the lower right side of this panel. And essentially, they really revolve around three priorities: optimizing informed choice and outcomes for those living with end-stage kidney disease, reducing the risk of acute kidney injury and chronic kidney disease through prevention, early identification, and management, and thirdly, improving management, coordination of care and outcomes for patients with kidney disease. We'll move on to the next slide, please. So, towards that end, the most of the recent work we've done has focused on a number of projects. The one that's the ones that are, I think, currently most active right now are the Must Act project, which is a PRIUS-funded project. This is a provincial government funded project that aims to increase access to and improves the patient's experience with kidney transplantation, specifically identifying potential kidney donors for patients in need of kidney transplantation. And the second major project that we've undertaken in the last 18 months is the development and implementation of an incremental dialysis program. So essentially, this has really was meant to improve the transition in care from pre-dialysis to dialysis, particularly for patients receiving facility-based hemodialysis. And the idea behind that project was really to develop a more patient-centered approach to starting dialysis that would be personalized to an individual patient's preferences, goals of care, and also to sort of minimize the treatment burden for each patient as much as possible. Next slide, please. So in terms of the patient participation in our strategic clinical network, we have very active patient advisors and who have been very much involved in improving access to materials that support patient-provider care. So any sort of patient information that is developed within our strategic clinical network is co-developed with our patient partners. And an example of this would be all of the information that's currently on the Alberta Health Services websites that relate to transplantation. Much of that work was co-led and certainly had active participation of our patient partners within the strategic clinical network. As I mentioned before, the incremental dialysis was funded approximately a year and a half ago, and we started providing incremental dialysis to our patients starting chronic dialysis treatment in Edmonton and Calgary in June of 2021. So this is currently rolling out, and this is after a one-year process with again with active engagement of patient partners as well as multidisciplinary stakeholders to essentially determine how to deliver this intervention, which is really more personalized treatment, hemodialysis treatment for patients starting this therapy. And then finally, as I mentioned before, the Must Act project led by Dr. Sarush Shojai is essentially a multidisciplinary intervention to help transplant recipients identify and communicate more effectively with potential kidney donors. And that's really through targeted education. I'll go on to the next slide, please. So, I mean, these are just our three most recent and perhaps most active projects at this time. Over the 5-year period that the Kidney Health Strategic section of the Strategic Clinical Network has been active, we have managed to accomplish quite a number of things in each of our high priority areas. So in the area of reducing the risk of acute kidney injury and chronic kidney disease, we've launched a pilot program for diabetes, blood pressure, kidney health checks in Indigenous communities across the province. We've developed and implemented an acute kidney injury pathway in hospitals in Edmonton and Calgary, as well as clinical decision support tools to prevent the development of acute kidney injury after cardiac catheterization specifically, as well as we have done work to support the recognition and early management of acute kidney injury in hospitalized patients across the province. Next slide, please. With respect to our goal of integrating care and improving the management and outcomes of patients with chronic kidney disease, we have facilitated provincial learning workshops for primary care on improving kidney disease care provincially. And that includes implementation of the chronic kidney disease pathway. And this is work that was led by Dr. Brenda Hemmelgarn, amongst others, and continues to be an effective and intervention for primary care in terms of improving the recognition and management of chronic kidney disease. We've also worked on developing a glomerulonephritis evidence-based care pathway, and this is work from that has been led by Dr. Ainsley Hildebrand. And this has really been about putting together all of the available information that we have in terms of state-of-the-art management of rare diseases, rare inflammatory kidney diseases, and making sure that that this management is available across the province. We've also been working most recently on SGLT2 inhibitors, which are a new class of drug that have shown great promise for reducing the progression of chronic kidney disease in both diabetic and non-diabetic patients. And so we're certainly been very active in that area in terms of trying to spread the word about the benefits of this medication, as well as lobbying, appropriate government agencies with respect to getting this medication covered. So more recently, we have been doing some work on mental health in dialysis patients, and that's really been led by Dr. Kara Shik-Makarov, who is a nursing professor here at the University of Alberta. And we're in the initial needs assessment to look to see what kinds of mental health supports that would be potentially most accessible for our dialysis patients. Next slide, please. Finally, we've managed to make quite a number of advances in the area of dialysis care. So the START initiative was really an initiative that was started about 5 years ago, and the aim of which was really to improve or increase the use of peritoneal dialysis and home-based therapies really across the province, and to ensure that dialysis, when prescribed, is prescribed appropriately across the province as well. And this was a successful project with a noted increase both in the use of peritoneal dialysis as well as an increase in the appropriate prescription of dialysis for all patients requiring this therapy. We've also developed and implemented a living organ donor wage replacement policy for Alberta Health Services, and this has also been quite successful, as well as developed patient education and resources for potential living kidney donors, including a website. Finally, we've also supported the development and implementation of the conservative kidney management clinical pathway, and this is work that's been led by Dr. Sarah Davison from the University of Alberta. And really, this is really to scale and spread the availability of resources for both patients and providers to improve symptom management and for patients with late-stage kidney disease. Next slide, please. So in the interest of time, I'll probably just skip over to this, but we continue to do work actively in a number of other areas within our strategic clinical network, including the support of patient researchers via the PACER program, which is a unique program in Alberta that supports patients both developing and conducting clinical research. We have also been actively working on developing health quality metrics in the area of kidney care, and that work is ongoing. We continue to monitor the kidney health of Albertans and submit a report approximately every 2 years to Alberta Health Services that really describes the prevalence of chronic kidney disease across the province, and have been working and also identified indicators of high value nephrology care to ensure that the care that nephrologists are delivering is appropriate. So we continue to hold regular research retreats and for the to try and focus on research interventions that will directly improve care for the health of all Albertans. Next slide, please. So obviously this work is done by quite a number of people. We are led by by Louise Morin, our fearless Senior Provincial Director, who leads the medicine and digestive health and kidney health strategic clinical networks. There are a number of senior medical directors, including Dr. Jen McCrae from the University of Calgary. Anita Kuzinski and Terry Smith really run our medicine strategic clinical network, and they are absolutely invaluable to our mission. And within the kidney health SCN, obviously, Dr. Scott Clarenbach and I co-lead the scientific office in collaboration with Dr. Marnie Armstrong, who is our assistant scientific director. Next slide, please. So there are always opportunities for patients or anyone who might be interested in improving the care of patients with kidney disease across this province to participate in our strategic clinical network. So I will leave you with this email address, and I would certainly urge anyone who might be interested in participating to contact us through the Medicine Strategic Clinical Network or even directly contact us through the Kidney Foundation. Thank you for your time, and I'm happy to answer any questions if there are any.